To improve organizational resources, the Strategic Prevention Framework model outlines key players in prevention practices. SPF defines resources as anything a community can use to establish and maintain a prevention effort that can respond effectively to local programs. To begin with, we need to prepare the people that are constantly around youth. This includes teachers, parents, coaches, youth group leaders, and other community members. They can be trained to assess changes in behavior or attitudes towards activities that can be symptomatic of mental health issues. They can also be aware of pressing issues in the community that need to be addressed with evidence-based research to discourage drug and alcohol use. By identifying areas where professionals can focus their efforts, it will be easier to prevent certain outcomes. For example, in a community where prescription drug misuse is the highest concern, one may suggest an anonymous drug drop, where residents of the community can dispose of their old and unused medication safely. This type of campaign can help spread awareness of proper medication management while also being cost-effective. Community leaders should be able to organize such events through existing programs in their localities. After-school programs, sports, and other youth-centered activities can help youth be engaged in their communities and focus on achieving positive goals. These can also support prevention efforts as adults can address issues that would affect the youth's future. Fundraising can involve these same youth as active participants in the prevention plan. They can work together to understand the dangers of drug and alcohol misuse while raising awareness in their community and supporting local efforts for prevention. There are a few different ways to help someone who is experiencing first episode psychosis. It is best to let the person speak without interruption. In this way, you can avoid passing judgment and try to assess how advanced the psychosis is through their emotions. Try to connect with the person and how they are feeling without playing into their delusion or hallucinations. These experiences can often lead to distress. Phrases like, "that must be so frightening for you," can help encourage more conversation. This can help assess the depths of their psychosis by listening and being supportive. The more information we have about one's state of mind, the better able we are to provide necessary services for the individual. The most important aspect of the conversation is to avoid passing judgment. Let the person express freely how their reality is affecting them, and ask how you can be of assistance to them. It is very important to encourage the person to seek professional help. You can recommend seeing a therapist for their symptoms while letting them know that help is available and they can feel better. You can try to explain that their feelings can improve with appropriate treatment and diagnosis through professional help. One can also help reduce stigma around seeking help by seeing it as a sign of strength. You should not discount what the person tells you during your conversation. The thoughts and sensations the person describes may not seem real to you, but they are very real to the person you are speaking with. In addition, it is important to remember that you should not dismiss warning signs if they are subtle or slow to appear. Not all cases of psychosis emerge with strong, clear symptoms. You may only notice a subtle shift in behavior. Acting on these small changes could be key to help stop the damage before it grows too strong to control. The Mental Health First Aid International organization also outlines important safety measures when approaching someone in a psychotic state. If you think the person may be in a severe psychotic state, approach them with caution. Be aware that the person might act on hallucinations or delusions. Your primary goal should be to keep the person, yourself, and others safe. Stay at a safe distance from the person while being able to maintain interaction and ensure you have clear access to an exit. It is important to assess for risk of harm to the person or others, and take any threats or warnings seriously. particularly if the person believes they are being persecuted. If you're frightened, seek outside help immediately, as you should never put yourself at risk. If safe to do so, try to limit access to means that the person could use to harm themselves or others by removing any weapons or objects that can be used as weapons from their immediate environment. If the person has a weapon, you should not approach them and should call emergency services immediately. Prevention programs and policies that are based on sound evidence-based principles have been shown to reduce substance misuse and related harm significantly. Evidence-based behavioral and medication-assisted treatments are applied using a chronic illness management approach and have been shown to facilitate recovery from substance use disorders, prevent relapse, and improve other outcomes. Keep in mind that psychosis can be treated like a symptom or a disease. It can affect someone for the rest of their life, can be induced by medication, can be brought on by the person's lifestyle, and lead to other diseases. MAT can also increase access to recovery and support services. Embedding prevention, treatment, and recovery services into a larger healthcare system will increase access to care, improve the quality of services, and provide improved outcomes for countless Americans. SAMHSA has also released additional material to help someone dealing with mental and/or substance use disorders. To begin with, start the conversation. Identify an appropriate time and place that you can sit and listen while also providing your concerns. Be direct. Ask them how they are feeling and describe the reasons for your concern. Acknowledge their feelings and listen. Openly, actively, and without judgment. Offer to help. Provide reassurance that mental and/or substance use disorders are treatable. Help them locate and connect to treatment services. Be patient. Recognize that helping your loved one doesn't happen overnight. Continue reaching out with offers to help. You may suspect or discover your loved one is dealing with a mental illness, drinking too much, or using drugs. As a family member, you can play a central role in getting them the help they need. People can and do recover. Family support can make all the difference. Remember, mental health and substance use disorders are treatable. Talk to your loved one. Express your concern and tell them that you're there to help. Create a judgment-free and loving environment to foster conversation and openness. Be open. Discuss your family history of mental illness or drug and alcohol use, if relevant. It may help your loved one feel less alone. Show compassion. Be patient as you help your loved one locate resources and treatment services. Be sure to care for yourself too. Being a caregiver can be highly stressful and emotionally draining. Seek support. If your loved one needs help, call 1-800-662-4357 for free and confidential information and treatment referral.